So thank you, Cha, for the very kind introduction and for the opportunity to share and discuss this work with your network. And over the next few minutes, I will introduce the second edition of the WHO classification and provide a high-level overview of how the updated classification is organized. And something that's very important as we talk about this update is supporting the use of the classification. So I will provide additional context on the practical applications of the classification by talking about specific use cases with real-world examples of how people are using the classification. And then I'll also touch very briefly on how we can leverage the classification to support digital transformation in countries. I believe that there are people within the audience that are aware and have used the first edition, so I assume some level of familiarity with this topic. But even if this is the first time anyone has come across this, then by the end of the webinar, you should be more enlightened about the classification. So this is just an outline of what I'll go through. I've just mentioned the outline briefly. And before I dive into providing the updates that are reflected in the second edition, a key and important update that we made was to the title. So the first edition, which was published in 2018, was called The Classification of Digital Health Interventions. And to reflect the improved structure and additional detail in the second edition, we renamed it to The Classification of Digital Intervention Services and Applications in Health. And this was published in November 2023. So it is a mouthful, but we needed to ensure that we were reflecting the additional detail that we provided in the second edition. Now, in order to appreciate the classifications, I'd like to go back to highlight what prompted the development of the classification in the first place. And the key aim was to provide a shared and standardized vocabulary, so a common language that can be understood by both technology-oriented audiences and those in health, to describe digital functionalities of digital health solutions and how they are addressing health system needs. And it's because the previous frameworks that existed, such as HL7 and ISO, provided highly technical terminology that was mainly intended for software developers in health and computer scientists. And so the classification then provides that common taxonomy for the digital health community to conduct inventories of digital assets, to identify gaps and duplication, to evaluate effectiveness, and also facilitate alignment across different digital health investments. Now, at a glance, this just shows how the classification is organized. There were several principles that we employed for the update. We retained the three axes around which the classification is organized, but we wanted to reflect novel digital capabilities that have emerged, especially since the first edition was published in 2018. And as we've seen a lot of change and evolution in health and the use of technology in health since then, we also wanted to ensure that any new digital capabilities would only be included where there was evidence in the literature of their use. So we were also looking at the advances in technology that had given rise to new interventions, especially in response to the global pandemic, and making sure that that was also reflected in the classification. So we decided to retain the structure that addresses the digital health interventions for the four primary user types. So persons, which we previously referred to as clients, healthcare providers, health management, and support personnel, which was previously labeled as health system managers, and data services. For the health system challenges section, it was important that what was not reflected in the first edition was considered and included in the second edition. And finally, we also wanted to improve the structure and the precision of what was called the systems categories section. So that section has now been renamed and it's called services and application types. So as I mentioned, it is still organized around the three axes. So we have the health system challenges, we have the digital health interventions, and we have the digital services and application types. And across the new classification, you'll notice several key updates. One key change that we've made, and I've already mentioned it briefly, is that clients are now referred to as persons or individuals. And this is to ensure that there is more neutrality in how we refer to individuals who access health interventions from the health system. We've also updated language where necessary to ensure that digital health interventions are inclusive of health systems that have a variety of policies and models for healthcare delivery. So, for example, it's not in every country that you would find that individuals access healthcare via health insurance schemes. And so we made sure that the language that we were using does not exclude those health systems that have a different model for healthcare delivery to their citizens. And then across the classifications, we've also added more synonyms and additional descriptors for the digital health interventions to allow users to be able to match semantically related terminology. And I point this out because when we were going through the process of updating the classification, we put out 2 public calls, and we got a lot of feedback from members of the public in the digital health community. And something that was a recurring theme in a lot of cases was suggestions were being made for inclusion in the new edition, but some of these could already be mapped to the existing classification. So it was important for us to highlight the synonyms and the additional terminology that can be used to describe the digital health interventions in this second edition, so that the community can easily map and match the terminology that they are using to describe their digital health interventions to what is in the classification, so that there's consistency in how we describe digital health interventions. And we also provide a link in the publication. You notice that there's a link to additional illustrative examples for people to access more programmatic examples. So in the publication, we provide just one example in each case, but there is a link that also allows people to access additional examples. I also mentioned earlier that one of the principles was also to reflect the evolution in the application of technology, especially in relation to the response to the global pandemic. So that's something that is a key content update. And the final general content update, which is quite significant, is that the previous system category section has been renamed. So we've renamed it to the services and application types, and then we've also restructured that section and grouped the services and applications into 5 representations according to their use within the digital health architecture. And so at a glance, these are the different elements of the classification. We have the health system challenges, which are the needs or the problems in the health system that reduce the optimal performance of the health system. We have the digital health interventions, which are discrete functionalities of digital technology that are designed to improve a health system process so that it can achieve health sector objectives. And as I mentioned earlier, the digital health interventions are targeted at addressing pain points for 4 types of users. So the persons, healthcare providers, health management and support, personnel, and data services. And we describe these user types in the publication. And just to point out as well that for data services, the updates also now include interventions relating to data governance compliance. So there's more detail within the data services section as well that we have provided. And finally, we have the digital services and application types, as I mentioned earlier, which was previously referred to as systems categories. And these are the digital systems or the technologies and the services that deliver one or multiple digital health interventions. And also, as we did in version 1, we provide examples of linkages across the 3 axes. So you can see how, for example, the digital health interventions embedded in a logistics management information system may be used to address a health system challenge that relates to inadequate supply of commodities. And there are more examples of the linkages that are provided in the publication. And I'll encourage people to have a look at those linkages and have a read of the publication. So now I'd just like to continue the discussion on the practical applications of the classification and talk about 4 different use cases. The first use case I'd like to highlight is around inventory analysis. And so, for example, I don't know whether people are aware of the Digital Health Atlas, which is hosted by the WHO and which provides a platform for countries, implementers, technologists, and donors to coordinate digital health activities. So in the Digital Health Atlas, technical implementers globally can document their projects within the Digital Health Atlas. And because the Digital Health Atlas uses the classification taxonomy to organize how these projects are recorded, users can easily use the data within the Atlas for analysis. Another example that I want to highlight relates to an article that I came across recently, where a group of researchers in Brazil used the classification to map what functionalities were provided by existing digital health apps in their country. Now, they were tasked with developing a communication channel during COVID-19 between healthcare professionals and patients' families. And part of the process that they adopted involved this mapping exercise to find out, what apps were already available and what gaps in functionality there were across the different available apps. So they used the digital health interventions taxonomy in the classification as a tool to do this mapping of functionality and to highlight the gaps. And they mentioned within their article that the analysis enabled them to gain an understanding of what were the most common digital health interventions used in those apps that they identified. Another use case relates to investment coordination and portfolio analysis. And the example I want to highlight here is one that has been shared with us and relates to an implementing organization in Africa, which used the classification taxonomy to conduct an analysis of digital health implementations in Kenya. So using the previous system categories, they highlighted what technologies were rolled out in projects within the country, but then they also used the digital health interventions to map what functionalities were being provided by those technologies within the country. And so they were able to see the distribution of interventions and technologies across different program areas within the country. And this next use case that I'm just going to talk about refers to some work that we are currently doing with colleagues from the Center for Global Digital Health Innovation at the Johns Hopkins University, which involves developing specifications for some digital health interventions that can guide developers in developing digital health products that meet specific needs. And so for a set of digital health interventions that are common across different use cases such as immunization, case-based surveillance, antenatal care, HIV, we're developing a set of generic components, including workflows and functional requirements, to help drive standardization. An example here is how the different digital interventions that would be embedded in technologies that are developed or used for routine antenatal care contact has been mapped. And this then forms the basis for developing a set of components, including business workflows and functional requirements for such technologies that will be used in that context. And this slide is just showing, other applications for which that work can be useful. So the work that we're doing with colleagues at Johns Hopkins University. I already mentioned about how it's useful in guiding developers in developing digital health solutions. And if you remember the article I referred to earlier, where the researchers used the classification for that purpose, apart from using it to map what digital health interventions were embedded in the technologies they identified, they were also going to use that information to develop a digital health solution that to meet the needs for which they had been approached to develop a solution for. And then other areas that this work is being applied to as well is in terms of identifying requirements for the digital health clearinghouse, and where the work could also potentially fit in is in helping with developing the SMART guidelines digital adaptation kits. And the last use case I will highlight here relates to standardizing terminology for designing research and curating findings. So when we talk about how research is reported in journals, we encourage the use of the classification to provide consistency in how digital health interventions, digital services, and applications are described, because it's important that that consistency in the way they're described helps us to understand the evidence base. So for example, a lot of digital health therapeutic products are available, and some of them may claim to increase patients' access to safe therapies and extend the ability for healthcare providers to care for patients. So in articulating research about, for example, in this case, a digital therapeutic product for chronic pain management that is based on delivering education to patients via text, video, or audio recordings, and in the hope of supporting patients in managing their symptoms, what you can see on the screen are linkages that can be drawn about the product, and those can be then used to articulate findings when researchers are doing any work and articulating their findings in journals. And finally, I'm just going to close with talking about leveraging the classification to support digital transformation in countries. Now, the classification is one of several resources that have been developed by the WHO and partners to support countries with their digital transformation. And here I highlight the Digital Implementation Investment Guide, which describes a structured digital health investment process that is divided into 7 phases. And the classification supports phase 2, which speaks to strategic planning aspect of the process. So we really encourage people to adopt the taxonomy and the terminology when working with countries and conducting activities to capture and identify digital health priorities in countries and regions. And finally, these are some of the considerations I'd like to highlight when leveraging the classification to support the delivery on a country's digital transformation plan or their national digital health strategy. So the classification can be used to conduct a national inventory of digital health assets and to strengthen governance, as I described earlier. And we have the Digital Health Atlas as a tool for stakeholders to use. You can also use the classification to map how existing services and applications fit into a broader ecosystem. And another way that the classification can be leveraged, thinking about the 3 axes that I talked about earlier, is to develop specifications that can then guide developers in developing products that fit in that digital health ecosystem. And there's a lot of talk, about ensuring interoperability of digital health systems. And so drawing on classification, especially as relates to data services, it can help with articulating requirements that leverage interoperability specifications so that we can drive benefits for health service users and ensure that we are encouraging the adoption of interoperable digital systems. And then finally, just thinking about, what are those priority health needs based on the country's national health plan and digital health strategy, and assessing how technology products fit within this overall strategy to support how digital health implementations fit into that broader strategy. The classification can be leveraged for that purpose. And so the classification can really help to structure, the thinking around digital transformation in healthcare, where the starting point is not the technology, but the why and what needs or what challenges need to be addressed. And then the conversation is framed around using technology to meet specific health needs and what functionality should be embedded in those technologies. And so the hope is that across the regions, across countries, the classification is leveraged for those purposes and to encourage that starting point in those conversations. And finally, just on the screen, you can see 2 QR codes that you can access the new publication with, through. The smaller QR code is the link to the feedback form. We encourage users and stakeholders, everyone who is using the classification, to look through the classification and provide any feedback you have through the form. And we would, like we did with updating the first version, we took into account a lot of the feedback from the public. We encourage people to provide feedback to us through the form. Thank you very much. That's where my presentation ends. I'll leave the QR codes up. And if anyone has questions, please feel free to go ahead.
Yes, thank you so much for the presentation, Ms. Chine. Start the discussions. I would like to hand over the microphone to our Executive Director, Mr. Jai Ganesh.
Thank you, Cha. Thank you, Chine, for the very interesting and then very crisp summary about the classification of digital health interventions. Like some of us from AeHIN we're glad, we have been involved from the version 1.0 as well as the current version. And then very happy to be able to arrange this webinar for our members. And then I also see, I think, some of our partners here. So maybe we will have a quick round of questions if there are any questions already on the chat. Or if somebody wants to ask, they can actually ask questions. But before that, maybe I can quickly pose one question, just in case if it is not covered in your presentation. I'm sure that you maybe as WHO, maybe these classifications will be coming out in various versions, various languages. Is there anything apart from English currently available? Of course, English is very relevant to our region, but I do see some partners currently online who work in the French-speaking part of the world. So is there anything coming up, Chine? Maybe you can update on that.
Yes, we are indeed providing translations to French, Spanish, and Arabic, and these would be available sometime mid-2024.
Oh, thank you, Chine. And another thing that I would like to express on behalf of the members is just in case if somebody wants to actually make use of the classifications in the work, our network consists of right from policymaker, implementers, national professional societies in informatics, digital health, academy, and then it's a wide variety of I would say that wide cadre of participants in our network. So in case if they require any support in terms of adoption of this classification in their work, is there a possibility that we can seek that help? Another way of putting it is maybe we can have more interactions based on how to use it, and then we can develop that. The idea is also as a network, we want to develop the capacity within the network. So any reflections from anyone online and any partners, for example, I do see our partner Foundation PFR and who have a repository of e-health projects. Maxim, do you want to say anything on that or any questions that you have for Chine, and then over to Cha for any other questions online? Thank you.
I think in terms of engaging with the WHO and engaging with us relating to the classification, definitely we are always here to provide support. I would encourage, though, that we have our regional offices that are very well experienced and very well poised to support at a country level. And so I would encourage people to reach out to the regional offices where there's need in terms of, you know, support using the classification. And of course, they will always coordinate with us at HQ with regarding to any needs. We also have a capacity building team, capacity building and collaboration team in HQ. And so when we get these types of requests related to training, we always reach out to our colleagues in the capacity building unit of the Digital Health and Innovation Department. So we do have all these resources and people available both at HQ level and at a regional level. So, but I would always encourage when it comes to a country level work to reach out to the countries, to the regional offices, and we would always support.
Thank you very much, Chine. Maxim, do you want to say something?
Sure, Jai. Thank you. Thank you for inviting us to join this webinar, and thank you for the presentation. It was really an interesting one. I think there's a couple of things this classification could bring out at our level and within our project. The first one, and I'd like to thank everyone who have contributed to this work, is the part on services and application. And it's, if we see the first classification, this one, it's not just a rebranding one, it's really gives more information. It's really more clear for people like us who work on documenting e-health projects and e-health solutions being implemented in various countries, to have a better overview and to better understand the different groups. It's also, I think, a really good tool that could help in learning and training programs for stakeholders and Ministry of Health to help them better understand digital health architecture. So really thank you for that. Once again, I think regarding the classification, it's the update is also really nice and really take into consideration the current challenges, the evolution regarding technology used, and you know, behaviors regarding health seeking informations, like the impact of social networks on health information, and artificial intelligence and generative artificial intelligence. So that's really a good thing as well. I think this work will be also useful for us for doing field surveys, evaluations of e-health projects, and is really a complementary matrix to the guidelines on the I-checked guidelines, for example, that provide practical tools to document to in-depth e-health projects on the fields. So yeah, an amazing work. Can't wait for next steps and use it in all different activities. I keep in mind the last your last intervention, Chine, on the capacity building team available for dissemination. I think we have a couple of training programs in French-speaking countries, and there definitely could be some synergies, and we could discuss how we could have synergies on dissemination of this amazing work. Thank you very much.
Thank you, Maxim. It's great to hear that, you know, in terms of the way that we have restructured especially the system categories, what was previously called the system category section, is useful to our digital health community and all our stakeholders. I know that was an area where a lot of people provided feedback in terms of how we needed to update that. And as a result, we have provided that additional detail and provided, you know, gone more in depth to enable, you know, when you talk about mapping and analysis of portfolios within countries for e-health projects and for digital health technologies within countries. That is very important. I think one thing to mention though is that as people use the classification and go through these projects, that they also feedback to us where you identify any gaps. If there's something that you still can't map and there's something that you still can't match based on what we have in the second edition, it'll be useful to provide feedback through the form to enable us to consider it as we update the classification further. We see how health is evolving, how digital in health is evolving continuously. So, we anticipate that, there might be additional digital health interventions that may come up in the future. And so there's a need for consistent and continued feedback to us so that we ensure that is fed into any future updates.
Thank you, Chine and Maxim. Thanks, Maxim, for your reflections. Cha, I think we have some questions from the participants. Maybe you can read out.
So one of the first questions that was entered here is from Dr. Aminul. So Ms. Chine, the question is, how do you address challenges, bottlenecks, and pain points through digital health interventions case to case? Is there any specific tools to mapping?
That's an interesting question in terms of, addressing those pain points case by case. This is something that our colleagues within the capacity building team also address. Well, they addressed with the first edition in terms of, how to do these types of mappings and how you can break down the pain points and the bottlenecks in order to tease out what digital health interventions could address those pain points. So it's something that's addressed within the training aspect of using the classification, which is handled mainly by our capacity building and collaboration team. And indeed, like the person who sent in the question mentioned, you do have to break down those needs. So we have the health system challenges, and it's mainly at a high level, but you have to break it down and further to find out what those bottlenecks are and what those pain points are in order to be able to identify specific digital health interventions that could address those needs, and in turn identify what technologies can host or those digital health interventions, or what how those digital health interventions can be embedded in any technology. And I hope I answered that question.
Yes, thank you. Yeah, so Chini is definitely right about what she just said. So just to add a couple of things, you have to break down the system challenge into a pain point and the pain point into a bottleneck. And then you have to work to find out your user persona, who are you trying to solve the problem to. And then that's where you ask yourself a lot of whys. You have to ask yourself why 5 times, for example. Why I cannot notify, for example, data through the system. Okay, I don't have internet, I don't have electricity. Why don't I have internet? Why don't we have a generator? So those are small points that you look at until you have to the last why, and that's your root cause. Once you find out your root cause, that I cannot notify a new child that's born into the immunization system, for example, you have to find out, okay, how can I link the mother to the community health worker? And then that's the situation where you have to use a longitudinal data tracking, and then where you have DHIS2, Open MRS, etc. And then that's where you actually find out your specific problem is solved. And then once you scale up, the health system challenge is solved. So that's just an example. I would love to go more in our next section, but overall, I think that's what it is. Thank you.
I'll just address the question around if there are any specific tools to mapping. Like I said, we have, when it comes to the training aspect, we have the capacity building team who support that aspect. And I believe that there's some work also going on around, how to map, especially the health system challenges, and identify, or articulate what those health system challenges actually mean. So it's something I can I'll definitely follow up to see whether that is something that we could also develop to support the community around specific tools to enable the mapping of the three different axes. And like the colleague Sakuba mentioned, indeed, it is you have to break it down to that tiny detail, to that level of detail. And also within the Digital Implementation Investment Guide, so the DIG, it's also there in chapter 3. There's additional detail in there that people can use to help with this whole mapping process.
Thank you, Ms. Chine. Going back to the other question, it's from Dr. Alamgir. It reads, can we consider AI-based apps as digital health?
AI-based apps definitely can be considered as digital health solutions. We have also made sure that we, to an extent, we represent and reflect that within the classification. So you'd notice that there are digital health interventions that talk about generative AI and how that impacts, how those digital health interventions apply to whether it's persons or healthcare providers. So certainly, indeed, if we can consider those digital health solutions as well, AI-based apps as digital health solutions.
We have another question. This is from Dr. Alvin Marcelo, one of the directors at AeHIN. So his first question is, will WHO provide links from health needs to intervention, to services and applications, or will the users be the ones to perform this linking? Also provided the use case where users enter their health needs and the classification prescribes interventions and services.
So I think at the moment, the resources that we have, including the DIG, as well as the classification. So at least within the classification, we provide examples of these linkages. For every project or when users are undergoing any sort of mapping, I think it's always useful to apply to the context that is in question. And that could mean that, like when we talk about health system challenges and breaking it down to those pain points and what bottlenecks are causing those challenges, it could mean that the approach to delivering a digital health intervention could differ based on the context. And so we provide examples within the classification of how to do the linkages. Within the DIG, there's also that example of how to do that. I think if we have a prescriptive solution whereby you enter a use case and then it provides you an intervention or a service and links to a digital health intervention, might not necessarily be the best way, because the context in which a user might be trying to apply the classification might differ, and the approach might be different based on those specific bottlenecks.
Thank you, Ms. Chine. Dr. Alvin has a follow-up question. Do you foresee the classification becoming input to a tendering process for specific services and applications by government digital health agencies?
I think that is where we hope that things will begin to move towards, whereby these procurement processes provide the detail in terms of what sorts of interventions the projects are trying to address. So like I mentioned, when we talk about the digital health interventions here, we're talking about those functionalities that are embedded in technologies. And really those functionalities are addressing needs. And so if within, procurement processes, tendering processes, the needs are outlined and there are specifics around what interventions they want to provide, that could mean that the technology that's being offered or that's going forward for tendering might be different. You know, you might have a specific technology that is able to address different digital health interventions because it has those digital health interventions embedded within the technology. You might have vendors who come with technologies that, if they can't fully meet, you know, all of those digital health interventions that have been prescribed in the tendering process, that would then differentiate which technologies would be chosen versus which ones would not. So the hope is really that as we talk about this consistency in language and this common taxonomy, that, you know, government digital health agencies begin to use the classification as well to put out, you know, what exactly they need in terms of what needs they want to address and what functionalities they want, you know, solutions to be able to provide. So I see Garrett, who's the unit head for digital health and innovation. I work with him. He's just come on camera. So go ahead, Garrett.
I just wanted to say, I think AeHIN has always been a very robust community of practice that really represents the intended users of the classifications. And we would very much value the feedback that and experiences that you have around using the classifications and any modifications or suggestions that you can offer as we think about an additional update to it. I think Chine provided a helpful, I hope, overview of the different use cases. We would very much welcome in the feedback form any additional use cases that you identify and other areas that you feel you'd like to feedback on. As we move forward, we'll try to build a broader understanding of and ensure that this is an institutionalized approach within you know, digital health technical support that we and others provide through capacity building, and Derek is online as well, my colleague who leads that work. I think the aspect that that Alvin, you raised around procurement, I think I just noted in the chat. I think this is a really critical question that we know countries as well as financial institutions are looking for minimum specifications to define how procurement can take place to really drive toward better global goods, and ideally more local global goods or software that is consistent with the kind of capabilities that countries are looking for, and that use open standards, so that you know, countries are able to really ensure that the procurement that they're doing is going to ensure that they're in a good place moving forward. So we very much welcome that kind of approach as well, and very much are thinking about how to support that on our side as well. Over. Thanks.
Derek, you are here. Glad to have you. Any reflections from you? You are the lead for the capacity building and collaboration at DHI. So no, we really need you to build the capacity in our network. And one of the aim of arranging this webinar is actually to make use of the classifications in our works. You know, variety of, as I said, like, you know, our members come from a variety of backgrounds, but how actually we take these classifications into practice. So that's our, you know, aim behind arranging this webinar. So could you please have your reflections? Thank you.
Thank you so much, Jay. I wanted to begin by, you know, echoing what my colleague Garrett Mail has cited in terms of how AeHIN has been a robust institution of engagement in as far as uptaking WHO guidelines and instruments. This is very much part of the expectations of the Global Initiative on Digital Health in as far as working with communities of practice. And so we are thankful for this particular event, which by itself is a capacity building mechanism. And thanks to Chine for articulating this particular classification in a very clear and straightforward manner. 2 points I'd add, Jay, to your question and your comment as follows. The unit I lead is really around fostering capacity building through the 7 building blocks of the enabling environment. We see this body of work as contributing to one of the pillars of the digital health building blocks related to services and applications. And that particular pillar connects back to the Digital Health Atlas, which is the means by which we support member states to account for the digital interventions that they're investing in. But how does this practically take place? The course that Ken was talking about, the Digital Health Planning National Systems, has been an instrumental vehicle to build capacity, both from the knowledge perspective, but also from the practice perspective, enabling national actors to systematically digest the classification and progress in a systematic manner towards implementation. And so we would welcome in 2024 specific deep dives using that course, saturating the course through the network so as to enable a very systematized uptake of the classifications. This is more important because 2024 is our climax in terms of the global strategy on digital health. And we look towards the Digital Health Atlas as a means by which we account for the different digital health interventions that member states have been able to uptake over the period. And so we look forward to working with AeHIN to ensure the uptake through training, but at the same time, to ensure proper governance on digital health products through the vehicle of the Digital Health Atlas itself. Thank you so much, Jay, and back to you.
Thank you very much, Derek, for this reflection. It's very, very helpful.
Thank you, Sir Jai. Maybe we can have our last question. This is from Dr. Malinda. It reads, does the guide attempt comprehensive mapping of health system challenges to DH intervention solutions?
Thank you, Chair. I think I've sort of addressed it earlier in some of my comments. There is a tool to help within the DIG, the Digital Implementation Investment Guide. But then also we have examples in terms of how to do these linkages. But like I mentioned earlier, the mapping needs to be done within the context of whatever projects are being done or whatever program area is being looked into. But certainly, like Derek mentioned, there is, there's a lot of training that his team do, and I work with his team to ensure that we embed some of this into those trainings so that this mapping is something that people can do easily. I think it appears that the mapping of the of these linkages is something that is very key for most people in terms of how to use the classification, and certainly should be, because we're talking about digital transformation, moving away from technology to addressing the needs using technology. So hopefully you like I said, I've mentioned previously, you look at the DIG, there's information in there, chapter 3, that can help. We provide examples in terms of linkages, and the training course that Derek mentioned is also another useful tool when it comes to that mapping.
Thank you, Ms. Chine. Now I would like to hand over the microphone to our Executive Director for the closing.
Thank you, Chad. Thank you, Chine. Thank you, Dr. Garrett Mill. Thank you, Derek. And thank you, everyone, for your participation. I think it was very, very, very helpful. And as a network that believes in peer learning, peer sharing, and peer support, we believe these classifications will be very useful in our day-to-day work. And we look forward to actually take this classification into action. That is like how we can actually make use of this. And we look forward the support from WHO, the country offices, the regional offices, as well as the HQ team in building this capacity in our region. I think with this, we would like to wrap up this webinar. And thanks once again for being with us and then enlightening us in this very interesting and useful topic. Thank you.
Thank you.